Hello and good evening, everybody. This is Nurse Eunice with Florida Training Academy, and in tonight's video, we're going to be discussing urine, stool, and the clinical significance. If you are one of our returning viewers, we thank you for returning and watching tonight's video. I'll be monitoring the chat once it is time to do the practice questions. The practice questions will be towards the end of this particular video. So let us go ahead and get started. First, we're going to start with our introduction and our disclaimer. So our disclaimer. The following video is for educational purposes only and is intended for healthcare professionals, including nursing assistants. Please be advised that this video may contain sensitive images related to bodily functions, including urine and stool, which may be unsettling to some viewers. Viewer discretion is advised. Also, please limit the number of questions I receive regarding medical questions because I'm a nurse. I cannot give medical advice. So if you do have any specific questions related to the color of your urine or your poop, I need for you to consult with your physician. Okay, that's the end of my disclaimers. Hi, everybody. All right, so let's start off here. So one of the reasons why I want to actually make this video is because the color of your patient's urine and stool can tell you a lot about their health and or their health condition. So monitoring urine output and bowel movements is critical for caregivers, including CNAs, because the patient's bodily functions can provide valuable insights into their overall health and well-being. And here's why. Let's talk about the assessment of hydration status. So urine output is a key indicator of a person's hydration status. So as a CNA, when you're monitoring the frequency, the volume, and the color of your patient's urine, it can help you to identify if they are adequately hydrated or at risk of dehydration. And so dehydration or not consuming enough fluids can lead to serious health complications, especially in vulnerable populations, such as the elderly or individuals with certain medical conditions. Another reason why we need to be monitoring the patient's output is because the urine can let you know about the patient's kidney function. And so the kidneys play a vital role in filtering waste products from the blood and regulating fluid balance. So changes in urine color, clarity, or the presence of blood or sediment can indicate issues with kidney function or urinary tract health. Monitoring these changes can help caregivers identify potential kidney problems early on and intervene appropriately. All right, so next, and we have about 10 slides before we actually get to the different colors, but detection of illness and or infection. So changes in the color and consistency or odor of the stool can indicate digestive issues, infections, or other underlying health conditions. By monitoring bowel movements, caregivers can identify symptoms of gastrointestinal problems such as diarrhea, constipation, or the presence of blood or mucus in the stool. Early detection and intervention can help prevent complications and improve the individual or your patient's quality of life. All right, so now let's learn about the different colors of urine and fecal matter and what they might indicate. All right, and so here with the colors of urine, it goes all the way from pale to a dark color, which could be a brown. But here we're specifically talking about the color of urine that is pale to amber, pale yellow to amber. And so that is suggestive of normal urine color. It indicates adequate hydration. If the urine is too clear where it doesn't have any tinge of yellow, usually that's because the person's overhydrated. And that can sometimes happen in your hospitals whenever a patient's on intravenous or IV fluids and we're giving them a lot of fluids. That can make their urine extremely pale. All right. Cloudy or murky urine. So cloudy urine may indicate the presence of bacteria, white blood cells, or mucus, which can be a sign of a urinary tract infection. And this is what I hate to see. Sometimes I'll see this in our nursing home patients when they are severely dehydrated and they become septic, meaning that they have an infection that's throughout their body. And so, whenever their kidneys start to fail or they become severely dehydrated, their urine can become like a burnt orange or a brown color. And so, this coloration may be caused by certain medications, liver problems, or dehydration. In some cases, it could also be caused by rhabdomyolysis. That's when the muscle starts to break down, and those byproducts are excreted in the urine. So make sure if your patient's not drinking properly that you notify the nurse. Otherwise, their urine is going to become extremely dark, and that is a sign that they could be having organ failure. Make sure I didn't miss a slide. All right, so for our next slide, we have red or pink colored urine. So this could be due to the presence of blood in the urine, and we call that hematuria, which may indicate a urinary tract infection, kidney stones, or other kidney problems. It can also be caused by certain foods or medications. Right, and so here's another example of, or our first example of the different colors of fecal matter or poop, and we'll get to the feces next. So we talked about the urine. Now we're going to go to the different colors of stool. Right. So the normal color of stool is brown, and that's caused, and this is the normal color, is caused by the breakdown of bowel pigments in a digestive process. So brown is normal, but it could be your patient can sometimes have diarrhea, which would be the liquid stool, or they could be constipated, and sometimes they let out hard stool. So just telling us the color of the stool alone isn't as important as telling us the color and the consistency of the stool. But normally brown stool that is semi-formed or formed but not hard is acceptable, and that's normal for your patient. Now let's talk about the black stool. So black or tarry stools can indicate bleeding in the upper GI tract or gastrointestinal tract. And this can be caused by problems like bleeding ulcers. So whenever the blood mixes with the gastric juices, it turns black. But I don't want you ever causing your patient any anxiety or angst. If they do have black or tarry stools, you can ask questions such as, this normal? How are you feeling? Because blood isn't the only reason that someone could have a black stool. Sometimes when they're taking food and supplements, if they're eating black licorice, when that is digested, the stool can become black. Sometimes blueberries, different types of meat, if they have lead toxicity, or believe it or not, if they have Pepto-Bismol. Pepto-Bismol has charcoal in it, which is black. So that too can make their stools black. So again, when you notice something that's abnormal, just ask the patient, is this normal for them? And then you can go let your nurse know after you get to taking care of your patient. But other reasons why a stool can be black could be medical conditions such as the bleeding ulcers, gastritis, or the inflammation of the GI tract. They can also have a Mallory Weiss tear, and that would be, of course, something that needs to be surgically repaired. Continuing with the colors of fecal matter, if the stool is red or maroon colored and it's fresh, so remember, if it's digested, it's going to be black. So undigested blood is going to come out red or maroon colored, and that could indicate that the blood actually came from the lower GI tract, not from the upper tract. It could be due to hemorrhoids, but normally, unless they have an actively bleeding hemorrhoid, it's not going to be as much as what we see in this commode. So it could be an anal fissure or a tear, or more serious conditions like colorectal cancer. Anytime you see blood that is abnormal, you're going to make sure that you let your nurse know right away. And these are different reasons why a patient may have blood in their stool. We mentioned hemorrhoids, so that's if they strain on the way out. You'll usually see blood tinge stool versus stool that's mostly blood. They can have inflammation in the colon. They can have polyps. Sometimes with the constipation, when the stool's hard and they're pushing, they can actually cause a hemorrhoid. And that can actually cause some bleeding on the way out. If they have untreated bowel infections, and we already mentioned the colon cancer. This is something I rarely ever see as a nurse, But your patient could have yellow or greasy stools, and this indicates that they have malabsorption of fats. They're not digesting the fat, so it just comes out. And when you look at the stool, it does look oily. And this can occur in conditions such as celiac disease or pancreatic insufficiency. So I hope you're taking notes because we're going to be taking a test in a few moments. We'll go through about 15 practice questions to see how much you remember about the urine and stool. And so that way you can make sure you're taking good care of your patients. All right, so let's go. Yellow stool causes, it could be intestinal infection, it could be celiac disease. Maybe they're eating a whole bunch of food that have yellow dyes. It could be giardia, it could be pancreatic problems or liver problems. Right, and here's another different color of stool. We have the green stools, and green stools are not always bad. Sometimes green stools can be caused by the person eating a lot of green colored food. So you're vegetarians. If they go on a spinach binge, well, then their stools may be mostly green instead of brown. But persistent green coloration may indicate a bowel-related issue or infection. So remember, we talked about those digestive juices. The bowel is usually green. And so if this person is not eating foods that are usually green in color, yet their stools are green, that they more than likely have some type of gastrointestinal infection or an issue with their bowel, their gallbladder. They need to be seen by a doctor. White stools. White stools can be a sign of an underlying medical condition like liver or gallbladder disease, but also certain medications like antacids. Think of milk of magnesia and the enemas that we give the patients. They can also turn the fecal matter white. So again, when you see something abnormal, you don't freak out. Don't cause your patient too much anxiety. Ask if this is normal for them, and then go notify your nurse. All right, so by monitoring these colors and any changes, caregivers such as you, my CNAs, can provide valuable information to the nurses and the medical team, enabling timely interventions and improving the overall care and well-being of the patients that you serve. And so now I'm going to go back to the comments because it is time for us to do 15 practice questions to see how much you remember about taking care of patients with their different colors of urine and also fecal matter. And for those of you all who were tuning in a few days ago, we are only about 300 subscribers away from meeting our goal of 500,000 subscribers. So if you are one of our subscribers, we thank you and we appreciate you. And let's go ahead and get prepared for our test. Here we go. Question number 1. What does yellow urine typically indicate? Is it dehydration, overhydration, normal hydration, or kidney infection? And I see all the hellos. Hello, everybody. We'll give you a few moments to answer. What does yellow urine typically indicate? Dehydration, overhydration, normal hydration, or kidney infection? All right, and I see a lot of C. So remember that yellow urine is normal. And so usually that means the person is receiving an adequate amount of fluid. So normal hydration. Question number 2. What might red or pink urine indicate? Dehydration, overhydration, normal kidney function, or kidney stones? I love it. The answers are not coming as fast with this one, but the answers I see are correct. So great job, everybody. If you chose D, kidney stones, you are correct. Pink or red urine can be a sign of the presence of blood, indicating conditions such as kidney stones or urinary tract infections. Remember, those kidney stones, they're painful, they're irritating the kidney, and that irritation can cause urine, blood to be in the urine. So, great job, team. All right, let's go to our next one. What could orange or brown urine suggest? Liver problems, dehydration, overhydration, or normal kidney function? Orange or brown urine. I see correct answers. Everyone's torn between A and or B. And I agree with both of you all. But for this one, it's going to say that the correct answer is A, liver problems. But you're right, with severe dehydration, the person's urine could also be brown. So I'll accept either A or B for this one. But according to our notes and what we just read, orange or brown urine can indicate liver problems, dehydration, or the use of certain medications. Number 4, cloudy urine may indicate dehydration, normal kidney function, overhydration, or urinary tract infection. Yes, yes, yes. So many correct answers. Great job, team. Our patients are going to be in great hands with you as their caregivers. So if you chose D, urinary tract infection, you're absolutely correct. Cloudy urine can be a sign of the presence of bacteria, white blood cells. Remember, the white blood cells, they like to fight infection, and or mucus, which are indicative of a urinary tract infection. Number 5, what is the likely cause of black or tarry stools? Is it hemorrhoids, ulcers, normal digestion, or dehydration? I love it. I love it. You all are thinking. Yes, think it through. Black tarry stools. Remember, if it's black, more than likely it's been digested. So, where does digested blood? Where's the source? I don't think I've seen the correct answer yet. Pierre, I think you're the first one. So remember, if it is digested, normal, and that's when it turns black. That's because this actually the bleeding occurred in the upper GI tract, and that's normally caused by a bleeding ulcer. And so they will have a usually like a bowel movement, like diarrhea, but instead of it being full of brown stool, it's full of black stool. And that's an indication that this person has an upper GI tract bleed, some type of bleeding ulcer. So if you didn't know that before, please take some notes so that if that happens to one of your patients, you'll kind of figure out what's going on and you can get that nurse in the room right away. All right, so the next one, red or maroon colored stools may indicate hemorrhoids, normal digestion, overhydration, or colorectal cancer. So this isn't a speck of blood. This is red or maroon stool. What does that indicate? This one's tricky. Yes, Panda. So for you all, this one is not A because if it was A, it'd just be, a little bit of blood. But this one is red or maroon colored stool. So the entire stool is an abnormal color. So that means that this person must really have a severely abnormal condition, such as colorectal cancer. So red or maroon colored stools may be indicative of bleeding from the lower GI tract. So this is not digested blood. This is undigested blood, which is why the stool has changed colors to and it's red. And this can be due to conditions like colorectal cancer. With hemorrhoids, usually the stool is its normal color, but it's going to be specks of blood mixed in with the fecal matter. Number 7, yellow or greasy stools may indicate normal digestion, celiac disease, dehydration, or overhydration. And I want to give you all time to give the answer. Everyone has it correct. And Karen, you said it first. So, yellow or greasy stools are indicative of celiac disease, and that is from the malabsorption of fat. And also from pancreatic insufficiency. So I'm so proud of you. Number 8, what could green stools mean? Is it overhydration, normal digestion, bowel related issues, or dehydration? Green stools mean what? They could be eating a lot of broccoli, or as Nana and Karen and Mina Bamba and Tamika and Lynn and Chrissy and Panda, it could mean that they have bowel related issues. So great job. All right, number 9. Which of the following is the most appropriate technique for collecting a clean catch urine specimen from a patient? And we didn't cover this, but whenever you're trying to collect the clean catch urine specimen from your patient, do you want to do A, have them wipe the perineal area with an antiseptic wipe? B, collect the urine midstream in a sterile cup? C, use a urine collection hat placed in a toilet bowl? Or D, collect the first voided urine of the day? What do we mean when we say clean catch urine? So many correct answers. So proud of you. And it is B. Yes, you're collecting urine midstream. So collecting the midstream urine in the sterile cups helps to minimize contamination from the surrounding area, ensuring the specimen is suitable for testing. Yes, everybody, great job. Number 10, a patient has just provided a stool specimen for testing. What action should the nursing assistant take next to ensure proper handling? A, label the specimen container with the patient's name, date, and time of collection. B, place the specimen in a plastic bag and seal it tightly. C, store the specimen at room temperature until it can be sent to the lab. You all, that's going to be so odorific. Don't do that. Or D, mix the stool specimen with urine to preserve it for testing. Don't do C or D. What do you think the best response is? Yes, everybody, we need to do A. We have to properly label it. So we're going to put the patient's name, the date, and the time of collection. Then after that, you can put it in the bag. In most of our hospitals, we can just send it via a tube system directly to the lab. But if not, they have a refrigerator for specimens. You want to keep it refrigerated until the lab can come and pick it up. Number 11, which of the following statements regarding the collection of a 24-hour urine specimen is accurate? A, the first voided urine of the day should be discarded. B, the urine specimen should be discarded if any urine is accidentally spilled. C, the container should be kept on ice during the collection period. Or D, all urine produced over a 24-hour period should be collected in a single container. What is the most accurate? And this was tricky. For this one, I'll accept multiple. So for those of you all who said A, you're correct. But then don't forget about D. So after you discard the first voided urine, the rest of the urine for the 24-hour period will be collected. And this is what your 24-hour specimen collection device, this is what it looks like. And we'll normally keep this on ice. And the way we do so is we may take a bath basin, put ice in it, and then sit the urine collection specimen on top of that. And so all the urine that the patient produces for a 24-hour period after the first voided urine will be placed in this container. And then at the end of the 24-hour period, this is sent off to the lab. Number 12, when assisting a patient with a stool specimen collection, which instruction should the nursing assistant provide to ensure accuracy? And let's read through these carefully. A, collect the stool sample in any clean container available. B, use a stick to transfer a small portion of the stool into the specimen container. C, avoid placing toilet paper or other materials in the specimen container. Or D, wait until the stool has been exposed to air for at least 30 minutes before collecting the specimen. Which of these will help to ensure accuracy? So many of you all have the correct answer. For this one, it's not B because we don't use a stick to transfer. We use a tongue depressor, like that wooden tongue depressor. When your doctor makes you say, ah, yes, that's what we use. That's not a stick. So if you chose C, you want to avoid putting toilet paper or any other materials in that specimen container. If you do send a specimen off and it has tissue in it, the lab's going to reject it. So you wasted time, and your patient doesn't receive the treatment or the care that they need, because now we have to wait until they have another bowel movement before we can send a specimen down to the lab. So it should not be contaminated with paper products. Number 13, which of the following actions is appropriate when collecting a urine specimen from an elderly patient with mobility issues who is unable to use a standard toilet? Do you A, assist the patient to use a bedside commode and collect the urine in a specimen cup? B, place a urine collection bag directly on the patient's perineal area to collect the urine? C, use an indwelling urine catheter to obtain a urine specimen? Or D, instruct the patient to urinate in a bedpan and then transfer the urine to a specimen cup? And for we don't want to do C, because anytime we insert something foreign into someone's body, we increase their chances of giving them an infection. Plus, certified nursing assistants who are not trained as patient care techs in the hospital do not insert catheters. So the correct response for this one is not C. All right, I think I see the correct answer. I think it's Maggie. Let's see. Yes, Maggie, the correct answer is A. The person with the mobility issues, they didn't say that they were on bed rest. So hopefully they're going to be able to stand, turn, and pivot. They can use a bedside commode, and you can actually give them the specimen cup. If they're unable to hold it, you would hold it between their legs while they urinate into the bedside commode, and you would collect the urine specimen. So using a bedside commode allows the patient to urinate comfortably while enabling the collection of the clean catch urine specimen. So yes, a person with mobility issues can still, they don't have to be on the bedpan. You don't have to put a catheter in them. Just hold the cup beneath them while they're on the bedside commode. Number 14, which of the following steps is essential when collecting a stool specimen for testing for Clostridium difficile or C. diff? Is it A, using soap and water to clean the perineal area before collecting the sample? B, collecting the stool sample from the toilet bowl after a bowel movement? C, refrigerating the stool specimen until it can be sent to the laboratory? Or D, placing the stool specimen in a sterile container without preservatives? Excuse me. I think I see the correct answers. Let's see. This one's tricky. If you've not collected a stool specimen for C. diff before, I'm going to reveal the answer in 3, 2, and 1. I think I saw the correct answer about 3 times. But if you chose D. So it should be placed in a stool specimen in a sterile container without preservatives. Preservatives can actually interfere with the accuracy of the C or Clostridium difficile testing. So it's important to collect the sample in a sterile cup without any preservatives. So that's what's most important. And then again, after you collect it, you label it. Sometimes we'll put like a cellophane wrap on top of it if we have to put it into a tube system, but you would either put it in the specimen refrigerator or you would send that off to the laboratory. Number 15, and this is our last question, you all. I'm so proud of you. Number 15, which of the following urine specimens is most suitable for testing for urinary tract infections? So which of the following urine specimens is most suitable for testing for urinary tract infections or UTIs? Is it a random urine specimen collected at any time of the day? Is it a clean catch midstream urine specimen collected after proper perineal cleansing? Is it the first voided urine of the day collected immediately upon waking? Or is it a 24-hour urine specimen collected in a single container? So think about the older lady. Her urine smells strong. She's getting confused. Are we going to wait 24 hours? We are not. So I think I see the correct answer. And I think it is, my dearest Karen. Yes. So if you chose B, and Paula chose B also. So let's go back and look at that. So whenever we're testing somebody for a UTI, that's just clean catch. They're going to do exactly what you do when you go to the doctor's office. They're going to give you a wipe. You're going to clean your perineal area. You're going to start your stream of urine, and then you're going to put that cup to catch some of the urine midstream. So you can do a clean catch midstream urine specimen at any time of the day. And that's the easiest way to collect a specimen if we think that someone has a urinary tract infection. So you all, I appreciate you all, and I thank you all for being here and actually learning about taking care of patients. So I would not do what I do without you. So thank you all so much. If you have any questions, I'll stick around for a few minutes. Let's see. So Christine, Nana, Paula, Oluwala Sola, I apologize for mispronouncing your name. Adna, Panda, thank you all for attending. It was so many of you all. Any questions before I log off for tonight? You're very welcome. All right, some of you all have questions later. I was out of the office for 2 days this week, so I'm putting my email address in the chat. And if you have questions later, just go ahead and send me an email. I'll be in the office tomorrow. Good night, everybody.